Before approaching a victim, assess the scene. You need to be aware of the dangers that might be posed to you as a first aider or to the victim. These can include obvious dangers such as traffic, gas or chemical leaks, live electrical items, buildings on fire, or falling objects. Also, human factors such as the victim not being cooperative or an aggressor in the vicinity. Remember, you cannot help a victim if you become a victim yourself. Tap and shout, "Are you okay?" Tell them you are trained in CPR and ask if you can help. If the victim is not breathing or is not breathing normally, start CPR. Use the mnemonic CAB, which starts with 30 chest compressions. When you see a child collapse, call out for help.
Help!
Make sure the scene is safe to approach. When someone arrives, point to them and have them call 911 and get an AED. Remember to use personal protection equipment. Position your shoulder directly over your wrist with the elbow locked. Compressions should be at least 2 inches in depth. Push hard, push fast. Push to the rhythm of the song, Staying Alive. To treat larger partial thickness burns, assure the scene is safe and that the victim is removed from the burn source. Carry out the acronym AID. Cool the burn. Hold the burned area under cool, not cold running water until the pain subsides. In urban areas, EMS will likely arrive during this treatment. Do not apply ointment until the burn is completely cooled.
How about a little fire, Scarecrow?
Skin is the largest organ of the human body. Exposure to extreme heat, chemical agents, and electrical shock can burn the skin, causing pain, blistering, and in severe cases, irreversible damage. Burns are classified as first, second, or third degree burns, depending on the amount and depth of tissue damage. If the fingers, toes, hands, feet, or limbs are completely cut through or torn off, jagged skin and bone edges can sometimes be observed. There may be massive bleeding. By responding quickly, there is a good chance that the severed body part can be reattached. If you are not sure if the victim is a diabetic and suffering from too much sugar or not enough sugar in their blood, give sugar. The additional sugar will not be enough to cause further harm to those with high blood sugar levels. Heat exhaustion equals sweating. Get out of the heat. Heat stroke equals no sweating and is life-threatening. Get the victim out of the heat. Move them to a shaded location or, if possible, to an air-conditioned facility. Cool the person down as quickly as possible. Spray the victim with water. To test a possible stroke victim, remember the first 3 letters of the word stroke, S-T-R. S for smile, T for talk, R for raise arms. Ask the victim to smile.
Can you smile?
The smile test is used to check for one-sided facial weakness, a classic sign of stroke.